How do we know it's OCD? Let's check the way of the assessment and diagnosis process for OCD. Everyone will have upsetting thoughts and many people have certain ways of doing things. For most, these thoughts and behaviors are not a problem. What makes someone with OCD different? Assessment and diagnosis of OCD involve making the distinction between normal thoughts and behaviors and a diagnosable condition. The big distinctions are the amount of time occupied by obsessions and compulsions, the degree of distress, and/or the level of impairment, for example, difficulty attending work or school, or inability to socialize.
The American Psychiatric Association, or APA, defines OCD in the following way: the presence of obsessions and/or compulsions which occupy more than 1 hour per day, cause marked distress or significantly interfere with functioning. Obsessions: persistent unwanted thoughts, images, or impulses, intrusive, uncontrollable, excessive, provoke anxiety.
Compulsions is the repetitive behaviors or mental acts performed in response to an obsession, or in a ritualistic fashion intended to reduce discomfort or prevent fear even. How to assess and diagnose OCD? Mental health professionals use the specific interview strategies and questionnaires using the Diagnostic and Statistical Manual of Mental Disorders or DSM to determine whether or not a person has OCD. Clinicians are careful to ensure that a person's symptoms are not better accounted for by a different problem. Clinicians are careful to rule out other possibilities. For example, many anxiety disorders have similarities: fear of specific situations or things, avoidance, severe anxiety. Sometimes individuals dealing with depression will become intensely preoccupied with thoughts regarding their past failures. An accurate assessment is important because it helps guides treatment. Different challenges require different solutions. It is also important to note that OCD can also occur at the same time as other disorders. Sometimes a clinician may determine that one problem is primary, which may mean it needs to be treated first before other disorders can be addressed. As mentioned, OCD is similar to other disorders in some ways. Below is a list of disorders that are commonly confused with, or can occur at the same time as OCD. It may be useful to talk to your healthcare provider about the differences in more detail to make sure you find the right help. Common anxiety disorders include panic disorder, agoraphobia, generalized anxiety disorder, social phobia, specific phobia, post-traumatic stress disorder, anxiety disorder due to a general medical condition, and substance-induced anxiety disorder. Panic disorder, fear of recurrent, unexpected panic attacks. Agoraphobia, fear of specific situations such as buses or trains, crowded places or leaving home alone.
Generalized anxiety disorder or GAD includes excessive worry about real-life concerns. For example, health or money.
Anxiety disorder due to a general medical condition. Anxiety symptoms are directly related to a medical condition, can be ruled out by physician's exam. Post-traumatic stress disorder, the re-experience of fear following a traumatic event. Specific phobia, fear of a particular object or the situation, such as heights or snakes. Social phobia, fear of scrutiny, humiliation or embarrassment in social situations. Substance-induced anxiety disorder, anxiety directly related to the effects of a substance, such as cocaine. Differentiating OCD from other disorders.
Obsessive-compulsive personality disorder or OCPD. Obsessive-compulsive personality disorder and OCD are two different conditions with similar names. A diagnosis of OCPD describes personality traits such as extreme perfectionism, indecision, or rigidity with details or rules. People with OCPD is often highly devoted to work and can become workaholics. Other features of OCPD include being excessively meticulous and difficulty experiencing affection or enjoyment with others. While many people with OCD report having one or two of these traits, a person who has 5 or more of these traits will warrant a diagnosis of OCPD. There are important differences between the two diagnoses, particularly in terms of treatment.
Depression. Thoughts in depression are different than those in OCD. A depressed person is likely to ruminate about past mistakes and perceived failures, whereas a person with OCD typically fears things that could happen in the future. Another important difference is that person with depression often brood over their emotional state as a way to understand it better, whereas people with OCD usually try to avoid or neutralize recurrent thoughts.